There we go.
Okay, all right, we're all set. So, okay. Hi, Tina. I think I'm just going to dive right in only because I'll wait for the photo and bio to do that, your experience bit. But really, the first question I have for you is, I know you have a personal journey of transitioning from nursing to informatics and leadership as well. So, what would be really kind of top 3 to 4 skill sets that people should look to acquire if they are planning to do such a shift in their career?
Great, thanks, Neil. I think when I reflected on this particular question, I probably could list a number of things, but the top 3 that really came to mind, the first one was obviously really understanding the technology and increasing my own data literacy around it, and even that digital health literacy. But what I really needed to feel comfortable even before I transitioned was to understand what are electronic health records? What do we mean by digital workflows? When you think about it from a nursing perspective, you're so used to your nursing workflows, but you're not often thinking about how the digital aspects of your job tie into them. And so that's another thing, even just from a reflective perspective, but also learning what are those digital workflows that have been new in the areas that you may not have clinically worked for a while. And then that data piece is, how does data drive decision making? Nurses are very good at clinical decision making and utilizing data to make those clinical decisions. And so now it's about expanding that data input for yourself. So you're not just looking at the data that the patient is providing you, whether it be, your blood pressure monitor, et cetera, but it's actually, what does the electronic health record, for example, hold from a data perspective, and how does that bridge into the clinical decision making that you have? And so for myself, it meant taking some online courses. Attending conferences was one of the biggest things for me. It was a bit daunting, but going to digital health conferences just to get exposed to the number of vendors, I think that was a big learning curve for me, but just getting exposure to them and how those vendors meet the same clinical decision goals that you were trying to achieve as a nurse, and then shadowing or sort of and with others that work in IT to grasp those fundamentals. Then the other 2 areas that they aren't different areas, but they become a bit more prominent in the virtual health space, digital health space, or informatics spaces: change management and leadership. So leading digital transformation really requires managing resistance, because it's new and it's something that can often feel like it's being added to a nurse's workload, but it's something that is really required, and it's the new way of being. And so part of that change management, part of managing resistance, is that effective communication. And so really leaning into those change management frameworks, whether it be ADCAR, lean methodology, if you want formal training, but even just micro training in it, I think is really helpful. And so participating in any sort of change initiative in itself, whether it be digital health, informatics specific or not, but just really, again, diving into those change management methodologies that are so key to big transformations in healthcare. And then the last one was around project and systems thinking. That's something that nurses aren't often doing. Maybe in a leadership role, you're part of projects, but we aren't necessarily good at project thinking. We aren't project managers. We don't often have the opportunity to work with project managers. And so that sort of intersect was another big learning curve for me, and a fantastic one. I feel the skill set has just built so many more skills for me as a nurse, as a leader, and as someone in informatics. So learning how to manage projects, align those projects with strategic goals was certainly crucial to my learning. And I didn't need to do full project management training, but some basics in project management has been really beneficial to me. So if you can learn some of those skills, it will really be helpful and create more efficiencies when you actually are working with those in a project management role, for example.
Okay, yeah. So this is really great only because just to sum this up for the audience who would be listening to this later on, is I think spend more time to gain literacy on data, on the systems, project management, and change and leadership as well. So these are really top skills to make your transition a little bit seamless. So this is great. Okay.
Mm-hmm.
Which actually brings me to the next question is, what kind of challenges or pitfalls have you really experienced while you were doing this? I know we talked about skills, but what should
Mm-hmm.
people know before doing this, just to be a little bit careful?
Mm-hmm. The biggest challenge that I think I faced, and I don't know whether this is similar to others, but really the complexity of health IT implementations. I underestimated the impact and the heaviness, I would say, or the complexity is probably the better word to use, of how technology intersects with healthcare workflows and how what's happening in that day to day, but also with human behavior. And so as nurses, we're always looking at human behavior and how that works in their health complexity. But when it comes to layering on that human behavior as a practitioner and as a provider, as well as the patients and families, how they intersect with health IT. And so early on, it's easy to assume that solutions for health IT are just the technical aspects, but learned really, really quickly that it's, partner engagement, again, change management were crucial, and really understanding the experience of the provider and the patient in respect to the health IT components. And so spending time with frontline staff, listening to their concerns, making sure that their voices are there to really be part of that health IT process, from even just a conceptualization part of it to actual implementation to evaluation. If you haven't had that connection with the frontline staff or the point of care staff that are actually doing the work, you're going to miss components of it. And then the other piece, I think, Neil, that is really one that stands out for nurses during a transition like this is imposter syndrome. And so I sat in imposter syndrome for a long time because I didn't feel like I had the technical background, and I didn't have a lot of experience in leading informatics projects or virtual care projects. But that was really the opportunity for me to work with my own coach and others and my peers to really focus on what are the strengths in this that I can bring as a nurse. Problem solving, we're doing it all day, every day. Communication, it's one of our required strengths. We have to be able to communicate effectively, and that patient-centered thinking. And so when I was able to step into some of these informatics roles, I built that confidence to say, this is what I bring to the table, and here's where the strengths of the others from the technical side come into play, and we work together, and there's really that fantastic balance and intersect between all of the team members.
Yeah, and I am actually glad that you bring up the imposter syndrome, because this might be really holding people back, kind
Yes.
of thinking that it's incredibly complex. How can I make my way through? So I think this is a step-by-step process, acquire skill sets and gradually get into the thing. And I like that we
Mhm.
are not only talking about software and systems, but also people there.
Yeah,
So health
that's right.
informatics is not just your data systems and IT and process, but people around it as well. So yeah, and the third one that I have for you, Tina, is let's say if a nurse anywhere in the world is trying to make a leap into this health informatics or clinical informatics,
Mhm.
short term, what three actions would you advise to be taken, let's say in 6 to 8 months time frame?
Okay, yeah. So first, kind of going back to that learning the basics of health IT, taking courses on digital literacy in itself, just those basic pieces. And there's lots of those basic courses out there. Anything is going to help. But the other piece of it is around data analytics. So that there's that health IT, digital literacy piece. But if you can also dive a little bit into data analytics, I think that's a really helpful piece. Getting hands-on experience was number one for me. And so volunteering, even if it's not your direct role, to be a part of digital health projects or informatics projects in your area right now, just putting your hand up and saying, hey, I need more exposure to this, whether that be electronic health record implementation, upgrades, workflow redesigns. If there's any opportunity to be a part of those initiatives, that'll give you really great exposure. It will help build your own confidence levels as well as your credibility in the space. And then the last one, which I wholeheartedly believe in any new space for learners, is that networking with people, seeking mentorship, connect with those professionals, connect with the associations through LinkedIn, if that's where your platform is, through your committees in the hospital that you might be working on, looking at nursing organizations that are specific to informatics, and really just, again, looking for those opportunities to get a mentor that can provide some of that valuable guidance. And I can think of a number of people who were key to that exposure for me, and just to say, hey, this is what I've done before, walking me through previous projects that they've worked on, providing those learnings that they've worked on, but really just getting exposure to it. And so I think early on for me, I was able to work on some committees around best practices and in informatics, providing insight to policy around informatics and or virtual care, or even just simple projects around education in a virtual space. So learning the basics, getting some exposure or hands-on experience, and then finding some mentors.
Okay, great, fantastic. And so we have got the last question here. This is a question which I got from many nurses around the world. So it might be related to a perception issue, but there's a feeling that if they transition from nursing to health informatics or clinical informatics, they are leaving behind the patient care. So how would you explain this to a nurse?
Oh, this is a great question, and it is one that I struggled with, but I think what we need to remember is that there's a natural evolution of nursing practice into informatics spaces, into digital spaces, into virtual spaces. It's not a departure from nursing. Again, I go back to the fact that nurses are problem solvers. They're fantastic patient advocates. And working in informatics spaces allows us to really optimize care delivery, taking it from a personal patient level to a system level. So you're just taking the work that you're doing and expanding it to a larger level. So instead of caring for one patient at a time, you're actually impacting potentially thousands of patients at a time, a bit more indirectly, yes, but through enhancing workflows, improving patient safety and outcomes, influencing healthcare policies and practices. That's your impact as a nurse actually grows exponentially. And so it's really being grounded in that. And it is a space where it allows nurses to be at the forefront of innovation, ensuring technology works for the frontline nurses, the frontline healthcare professionals, and not against them, is something that you're going to do as a nurse, you're going to do to improve everyday life for nurses and everyday life for patients and families. So really, I think it's about a mindset, and that informatics allows us to scale our impact and improve quality, not just at the bedside alone, but from a whole system level. And so I think it's a huge opportunity, and it's a bit of a mindset shift for nurses.
Mm-hmm. Yeah, so really nurses who are hearing this conversation, I think you're hearing this from somebody who has done it and done it very successfully. So I think, yeah, so I think what I heard from you, Tina, is really, if somebody's trying to make the shift, it is actually making them amplify their impact. It's not just patient care, it's really amplifying the impact across the continuum. So this is really great. And this is, I think, a great way to wrap this up. Thank you so much. I know kind of taking the time out from your busy schedule to do this for us. And I'm sure this will reach out to many nurses who have lots of similar questions, will inspire them and motivate them to join this profession of health informatics. Thank you.
Thank you, Neil. A pleasure. And yeah, encourage everyone to take that leap and to dive into that innovative space.
Okay, I'll stop this.